more now. I am joined by Democratic Governor John Carney of Delaware, Lawrence Gostin, professor of global health law at Georgetown University. Thanks to both of you for joining us. Governor, let me just start with you. How would you describe life tonight in the state of Delaware?
Well, there's a sense of urgency, I hope, on the street. The situation has changed significantly in our state. Just a week ago, we had one positive test here in Delaware. Today, we're up to 30. We have 3 individuals that are hospitalized here in our state, one seriously. And so we're trying to tighten down our state of emergency. We're trying to get the message out to everybody to avoid social contact, to stay in their homes, to protect their senior citizens, their moms and grandmoms and granddads and grandpops, and just create really a seriousness about it. Up until this time, folks, I don't think have taken it as seriously as we need to do. We've closed the bars and restaurants as a result of that, but we need to be serious and really focus on, as Dr. Fauci says all the time, on flattening that curve, so reducing the spread of the virus here on the front end, which will help us on the back end. I think the really serious issue is hospital capacity, and we talked about that a little bit with the governors today on the conference call with the White House.
Pardon me. I have heard conflicting estimates here about how long this is going to go on. There's that study from England that got a lot of attention this week that said the idea of this extreme level of social distancing could continue pretty much for 18 months until there's a vaccine. You've got Ezekiel Emanuel saying in the New York Times this week, maybe mid-May. To residents of Delaware, to folks out there asking the question, saying, okay, we're taking this seriously. We're prepared to stay away, from our jobs, prepared to stay away from recreational activities, stay in our homes largely. Realistically, how long should they be expecting to do that?
Yeah, I'm not a scientist. We've been taking our lead with the decisions we make here in Delaware based on the science. Dr. Fauci with NIH has been giving us great advice on our conference calls. Our public health officials, Dr. Odom Walker, the Secretary of Health and Social Services. So we use the science, think about the trade-offs, the risk rewards, trying to keep as many people working as possible, but recognizing that we need to flatten that curve on the front end to prevent a really serious thing long out into the future. And that would be very difficult for all of us here in Delaware.
Lawrence Gostin, on this question or this issue, I should say, of that skyrocketing now case number here in the United States, 13,000, the number of deaths increasing. The idea of flattening the curve going up right now in the United States. On the surface, obviously, that is very alarming news to hear. Is there a silver lining here, just in that this also could reflect an increase in testing?
It could, but, I think that our focus on how many cases there are, counting the cases, is beginning to make no sense, because really what's going on here is we've got a lot of silent transmission in the community. So it doesn't matter the cases we test and report. We know that there are many, many undiagnosed cases in the community. The trajectory is up, and our only major hope is that we're going to have quite strict social distancing, closure of schools, restaurants, bars, people self-isolating at home. We've seen that work in other places. And because it's worked, we're able to do some really mitigation that we wouldn't otherwise have been able to do.
Sounds like you might be getting a phone call there. We'll let you take that while we go back to the governor. This is the world we live in now. No issue there. We understand that happens when we're all cooped up at home there. Governor, though, in terms of the relationship between the administration and state governments like yours, there are issues here about supplies, about ventilators for hospital, about medical supplies, about where those are going to come from, about is the onus more on the federal government, more on the state government? How would you describe that relationship right now and how it relates in real terms to those needs in your state?
Yeah, so the way that we look at this in terms of emergency management is executing at the local level, managing at the state level, and getting support at the federal level. And we talked a little bit about that today with the announcement of the emergency declaration with bringing FEMA on board. And so we really look to the federal government for that kind of support and supplies. And we talked a lot on the phone conference today about those supplies that are needed, PPEs, personal protective equipment, ventilators. We need to understand the ICU capacity, the surge capacity at our hospitals, and each of the governors are on the ground managing that situation in their states. It was mentioned that 50% of the cases are concentrated in 3 states. And so it is not evenly distributed across our country, but we all have to be vigilant, and every citizen to take appropriate action to distance themselves socially, because they can spread the virus and it can increase in any locality. But we're really looking to the federal government for that kind of support from the strategic stockpile and reserve, the kind of support in terms of resources. And that's why the Congress's action, President signing that piece of legislation is really important for us.